So this documentary is called The Unseen Battles, and it's by Juanita Marple-Heffner, myself. Dr. Stephen Fogg, a cataract surgeon, struggles with insurance companies while trying to get the best eye care for his patients. Basically, the story arc is we would follow cataract surgeon Dr. Stephen Fogg, also one of his patients, going through the process of cataract surgery. It would also highlight staff involvement in this process, and then obviously we want to show Dr. Fogg actually performing the surgery on the patient and doing any kind of aftercare. The reason why I want to do this project is because I worked in eye care for over 3 years. I did healthcare for about 4. Most of it was eye care, and I've kind of have had the opportunity to see both sides of the story in regards to how insurance companies treats doctors and patients. You know, this documentary will answer the question kind of like, have you ever gone to the doctor and wondered why, you know, it costs so much to visit them, and even though you're paying your insurance? So that will kind of answer the question. Also answer the question of like, what do doctors do behind the scenes? Like, why do they get to charge so much money for their services? And so this will kind of answer all those questions. So the characters of our story is obviously Dr. Stephen Fogg. He's a specialist in ophthalmology and he does cataract surgery, and he's been practicing for over 20 years. We would like to interview some of his staff, particularly his testing staff, ophthalmologist assistants, and surgery consultants. All of these people are involved in helping a patient get ready for cataract surgery. And then obviously, we need to find a patient who's going to go through the process. This we would have to discuss with Dr. Fogg himself and get permission of the patient to film the process. So this is kind of our production team background. Myself will be wearing many hats. I'll be the producer, director, editor. The reason why this is so that we make the story flow very nicely. And I'm also the one that has all the connections to the office, so it just makes sense. We also need a camera and a sound guy, so we still need to find someone, and we're trying to keep the team very small because if we're going to be filming in this clinic, we want to make as little impact as possible. The rooms there aren't very big, the exam rooms, and so we want to be able to fit inside there with not having a bunch of this equipment in, so we need to make sure that everything is small and compact. So some project logistics is we do want to do a little more research, especially in regards to cataracts. You know, what are they? What cataract surgery entails? How does the insurance work? Pre-production, you know, we need to work very closely with the clinic to make sure that we create a schedule that is benefit to them and also is a benefit to us. And then obviously, we want to make sure we have enough time for editing, you know, finishing and post, because we do want to submit this to film festivals to get a bigger audience. And we also really want to submit this to educational institutions such as high schools, middle schools, universities, community colleges, etc., just to kind of widen our reach. This is kind of a budget summary. These are just examples of what kind of money we're trying to raise in order to fund this project. The reasons why we pick Patreon and Kickstarter is because they are very easy to fill out. The success depends on, you know, how well you advertise your project to someone. You can also invite people who maybe want to donate, but they can't afford much. You know, it would give them opportunity to also donate. The last line is we're basically just trying to find a grant for $10,000, and that's why it says Grant 1. So that's basically the presentation, and I hope you enjoyed watching.